Hey, anatomy students, Mr. Griffey, your simple anatomy teacher, coming at you here from room 227, West Claremont High School. And today we are going to look at the last in the video series on the respiratory system. This video is going to be a quick one, won't be too long. It's going to cover some disorders and allergic response to pollutants and whatnot in the respiratory tract. So let's go ahead and get it started. Today we're going to talk about some disorders and some problems that we may run into with our respiratory system. First, let's talk about response to pollutants. There is, in our respiratory tract, there will be an initial response. The mucus layer on the respiratory tract will thicken. Remember, the type of tissue, the type of epidermal tissue that we have in the respiratory tract in your trachea is my favorite, the pseudostratified ciliated columnar epithelium, and it contains goblet cells. The goblet cells produce mucus, as you can see here. Goblet cell there, goblet cell there. They produce mucus. The mucus then lies on the surface of the epidermal tissue, and it maintains a protective barrier. The cilia on these cells will, in a wave-like pattern, will move that mucus up towards the top of your trachea and up through the larynx, where it can be coughed up and or just swallowed. And then that removes those irritants. So when there is a pollutant present in the respiratory tract, the goblet cells will increase their production. Goblet cells will over-secrete mucus, making that layer thick, a little too thick, that can reduce the airflow. A lot of times when you go to the doctor and they listen to you breathe, they're listening for what they call a rattle in your breath, and that is the fluid in your lungs causing the air to vibrate as it passes over, and that fluid vibrates, and that's what causes that rattle in the lungs. Then, after the initial response, we have the advanced response to an irritation. The mucus layer and goblet cells will disappear. The basal cells become malignant and invade deeper tissue. One of the things that I learned early on in my career, at my collegiate career, was that cigarette smoke, and I'm sure that in the not too distant future, and we're already seeing studies with vaping, but the cigarette smoke, one of the things, aside from the tar and nicotine being a cancer-causing agent, one of the other things that the smoke does is it damages and destroys the mucus cells, and they no longer can produce the mucus that protects the lining of your trachea, and it will make your respiratory tract more susceptible to any other pollutants and irritants that you may inhale here, walking around, living here on planet Earth. Asthma is a disease where the respiratory tract is hyperreactive. The airway is hyperreactive, meaning it responds more fervently than it needs to. And what happens is there is a abnormality of the constriction of smooth muscle in the bronchioles and causes inflammation. And as we learned in the last lesson, if that causes inflammation, that reduces the airway, and that will increase the resistance to airflow by a factor of 4. So a slight increase in the the swelling, the lining of the bronchial tube will cause a resistance. The increase in that resistance will cause a decrease in the airflow. It presents as attacks of wheezing, coughing, and excess mucus production. And asthma has become more common in young people. When the last few years I was a middle school football coach, I walked around with about 3 or 4 inhalers in my pocket all the time, ready for my players in case they had their asthma attack, which they, in the early season when it was hot and humid, they regularly had to use their inhaler. It typically occurs in response to allergens, less often to emotion. The bronchodilators and anti-inflammatory corticosteroids are mainstays of treatment. And one of the most popular medications in the inhaler is albuterol. That is a very good anti-inflammatory for the bronchial tubes. Chronic bronchitis and emphysema. Remember, anytime we see itis, this means infection or disorder. The chronic bronchitis and emphysema are caused by chronic irritation and inflammation, leading to lung destruction. Patients may cough up a green-yellow sputum due to infection and increased mucus secretion, or what is called a productive cough, meaning that the cough will produce a noticeable amount of mucus. They are almost exclusively diseases of cigarette smoking. And vaping is still pretty new, but if I am going to make my prediction, I'm going to say that as we have people who vape for 10, 15, 20 years, I think we're probably going to see a lot of the respiratory orders of cigarette smoking are going to mimic vaping. I think that's going to be a problem that we're going to have with the increased popularity of vaping. Just my prediction. Pneumonia. Pneumonia is an acute infection of the lower parts of the respiratory tract. Remember, the lower part is anything below the larynx or your voice box. The small bronchioles and alveoli become filled with an inflammatory fluid exudate. So basically a bunch of mucus and fluid will build up in the lungs. And of course, if that fluid builds up in the alveoli, that reduces that individual alveoli's ability to absorb oxygen. It is typically caused by infectious agents such as bacteria, viruses, or fungi. So here's an X-ray showing normal lungs and X-ray of a patient with pneumonia. And you can see the fluid buildup is extensive to the point where it will actually reflect an X-ray. And that is going to conclude all the lecture material for the respiratory system. All right, that's it. Congratulations, you made it. That is, as I said earlier, that is the last of the lecture material for the respiratory system. So, as always, if for some reason we are on remote, go to Schoology and look for that exit slip. If you're watching these, to keep up with us in class because you are at home or quarantined, that will hopefully let you know what we've been doing. So, as always, thanks for watching, and let's not forget, click like and subscribe. Talk to you later.